switch off a halter, because you always want to be careful about what substances go in the chamber. And so these halters are cotton with brass hardware, so the natural fibers have less static electricity than synthetic fabrics do, which decreases your risk for a spark. And then those halters are reserved exclusively for the chamber, so we don't have to worry about any liniments or anything like that getting in. So at the moment we're pressurizing, so this is going to be what the pressure is actually inside the chamber, and we're going to continue to pressurize until we get to 2.5 atmospheres absolute, or 22 psi, so we're going to go up to here. So we just want to keep an eye on the horse to make sure he's handling the pressure okay while we pressurize, and you can see we're starting to get a little bit of pressure in there. And we do pressurize with 100% oxygen. So we start off with a little bit of ambient air, but we will build to a pretty high oxygen environment. It'll get to be about 90 to 95%. You're always going to have a little bit of ambient air in there, but pretty high concentration of oxygen. And it'll take about 20 minutes to get to that level. You can see from that view, or kind of standing in front of the other camera at the moment. So you can see he handles it pretty well. He's been in here a number of times before and he's used to it. There is a little bit of noise, but that's about as loud as it gets, and it's really not that different than going down the road in the trailer, so most horses accept it pretty well. Kind of the signs I'm looking for to make sure that he's handling it okay is, one, you don't want him to get too excited or get too stressed out. You can see he's chewing a little bit, so he can feel the pressure changes right now, but he's not having any problem adjusting to the pressure. So if you were shaking his head from side to side quite a bit or offering evidence of other signs of discomfort, then we would slow the rate of pressurizing, or we would take them out depending on what the issue was and how uncomfortable it was. Most horses don't have any problems adjusting to the pressure, but if they had an infection or inflammation in their guttural pouches or a walled-off sinus infection, something like that, they would be uncomfortable when they are pressurizing, and then we would need to kind of slow down or figure out what was going on to make sure it was safe to put them in.
Here, okay.
So we're almost to pressure, and when we get to pressure, that's when our actual treatment time will begin. So this particular treatment is going to be 45 minutes at pressure. So he'll be in there counting pressurization and depressurization time. He'll be in there for a total of about an hour. maintain that pressure, but we want to continue to allow the oxygen levels to build. You can see it's about doubled at this point. It's almost 50% oxygen, so that in 7 minutes the oxygen concentration is double. We're going to continue to build that oxygen level till it's above 90%, and then the chamber will automatically maintain that. So right now I'm continuing to let a little bit of air in, a little bit of that oxygen in, while I'm letting oxygen out, and while maintaining that same pressure. And that cycling will allow the oxygen concentration to continue to build until it gets above 90%. A lot of what we use the chamber for, it can apply to a number of different conditions because you are applying it to such a basic level. You're just providing oxygen at an area where there's a hypoxic environment before it, where there's a lack of oxygen. So because of that, we can use it for non-healing wounds, which is similar to humans, diabetics who have non-healing wounds. Or you can do it for different types of infections, whether it's a soft tissue infection or a bone infection. A lot of different respiratory issues such as bleeders or pneumonia. Post-surgical, whether it's an arthroscopy where you had a knee or an ankle chip removed, or you had a fracture that requires some hardware in there, or if you had a throat surgery, it's very effective for reducing the inflammation and reducing the risk of infection following surgery. Or you can use it for something as simple as post-competition recovery, where you just want to reduce the inflammation and get the lactic acid buildup out of their systems a little faster. It's not going to enhance performance, but if you use it following a hard workout, like in conjunction with your training program, or following an event, whether it's a racehorse or an endurance horse, a jumper, cross-country, 3-day eventer, you can really help them recover a little bit faster so that they're better able to perform and to train to their full capabilities. So, but it is kind of interesting when you're looking at the different types of species with the hyperbaric. With humans, they're not going to be as sensitive to the oxygen as a horse will, and then dogs and cats are even more sensitive and respond faster than a horse. So if you have something that might require 40 treatments in a human, it might require half that in a horse, so like 20 treatments in a horse, and then 5 to 10 in a dog or cat. So it can be quite interesting when you're applying it to different species.
Oh, cool. What? All right, well, huh? Oh, he was